President Obama, in his State of the Union speech a few nights ago, talked about opiate abuse. Why is that significant, and how big a problem is it here in the U.S.? Pat Reamer's here from Hartford Healthcare. She's a nationally recognized leader in mental health and substance abuse. She joins me now this morning. Good morning to you.
Good morning.
So we listened to that speech and we heard him really outline and make a point of bringing up that topic.
Right.
Why is that significant? What does that mean?
Well, I think what it means is that not only at a state and a local level, but at the federal level, there is really acknowledgement that this opioid abuse has become a public health crisis. We certainly are seeing it here in New England, but the fact that the President is mentioning it in the opening remarks of his speech signals that it's a problem across the country and a problem that we're all going to have to work together to address.
A problem apparently that's not going away is part of that not everybody thinks of addiction as a disease. We think of it more as someone choosing to do something, and we're not going to give them much time because that's their choice and that's their problem.
That's right. That's right. And so when we think about recovery, and recovery does happen for people, that recovery starts with treatment. And one of the issues that we do have to address and think about is making treatment available to people in a way that's very similar to the way it's available for other medical diseases, using things like medication-assisted treatment, which is a very well-researched and proven approach to opioid abuse or dependence, where you use medications like methadone or Suboxone to help people stay in recovery once they've begun that journey. There are multiple ways to address this, and I think that actually the state legislation made some really good improvements last year in a bill that outlines increased attention and responsibility for this.
So it sounds like there's never been more hope. It's not like someone suffering from this has to go cold turkey and good luck and, we hope you work your way through it. There is help, there is support, there are services, there is treatment.
Yes. And I think that there is more and more treatment. We need more treatment. Rushford Center, for example, is expanding its Suboxone program. So we have one in Glastonbury. We're about to open one in Cheshire. And those are specifically related to individuals who have substance abuse issues. They're outpatient programs. These may be people that are professionals, for example, that need to come in the evening. I think one of the things that is becoming a little bit more common knowledge, but we really need to emphasize is this is no longer an urban problem.
No, not at all.
We are seeing overdoses in all of the cities and towns across Connecticut, and younger, and it's very concerning.
I was going to say a lot of ages. It's not just kids. It can be professionals. You could be really shocked by who's dealing with this, couldn't you?
One of the things that we're seeing, and unfortunately it's getting attention, but the overdoses continue to increase. Since 2012, they've gone up exponentially, and every year they are increasing. One of the demographics that we're seeing is middle-aged white women who are becoming addicted to painkillers. And again, because it's prescribed, because a doctor is giving it to you, the idea that it's safe, and not understanding that you can easily overdose on some of these medications.
Yeah, the results can be absolutely devastating and not deadly.
That's right.
So if people are listening and they think, okay, I have a very strong suspicion, someone in my family, a friend, someone I know is dealing with this, but I don't know what to do about it, what do they do? It's good that there's treatment available, but how do you get them to that support system?
Right. Well, you have to begin to make calls. One of the things that I think we don't talk enough about is what does it look like when somebody is abusing opioids?
That's a good point.
So if you have a young adult living in your house who's wearing long sleeves during the summer, you might want to think about why that person is doing that. If you have somebody in your family or a friend that's spending a lot of time sniffing or itching, two signs that
itching their face?
Yeah. Opioids do cause, one of the side effects is itching. And so those are the little things that people can look for. If you suspect that somebody has a problem, I think that you can obviously call your PCP, but it's probably easier to access the system through a treatment program.
Right.
And so, again, places like Rushford Center, who have multiple centers across the state to treat this issue, and we will continue to open centers so that people in suburban areas, people in urban areas don't have to travel to get their treatment. We want to get treatment focused in the community where the problems are and allow people to access it with as much ease as they can.
Well, and the sooner the better, obviously.
Correct.
Taking action.
Right.
As soon as you possibly notice that there's a problem,
right,
the results are hopefully going to be better. And you don't have to feel hopeless. A lot of people pull out of this. Would you, like, what is the number there for recovery? Would you say most people do? Is it 50-50? Is it, I just want people to feel hopeful, like,
sure,
get out there, get help.
Sure.
And there is a good chance that you're going to pull through this.
Hope, recovery does happen every day.
Yeah.
And I think that one of the research statistics we know is that with medication-assisted treatment, you increase your chances of actually reaching and attaining recovery, and it's in the order of 75% better.
Fantastic.
If you do that.
Fantastic.
Right.
Excellent information. Thank you so much for coming in.
Thank you.
And you can learn more about through a free community discussion, opioids in our communities. Excuse me, a wake-up call. Tuesday, January 19th. It's 5:30 to 7:30 p.m. in Middletown at the Community Health Center.